Image of President John F. Kennedy signing the Community Mental Health Act. President Kennedy described this act as a bold new approach and provided federal grants to states to construct community mental health centers, CMHC. This act aimed to improve the diagnosis, treatment, and delivery of mental health services to individuals and prevent acute episodes that could impact their safety. In 1965, federal funding was allocated by the Medicaid Act to statewide institutions to improve conditions, staff education, and treatment of residents. The Community Mental Health Act resulted in a mass deinstitutionalization across the country, and by 1980, the population of psychiatric hospitals had decreased by nearly 75%. Deinstitutionalization meant that individuals with behavioral and developmental disorders were cared for in group home settings that allowed for community involvement rather than being isolated in a facility with little or no interaction with general society. By 2009, less than 2% of individuals with mental health disorders lived in a large institution, thus greatly increasing their quality of life, attention to their individualized needs and preferences, and their ability to be active in the community. Additional consideration has also been given to school-aged children and adolescents with developmental disorders and disabilities to be educated in a mainstream environment. In 1975, the Education of Handicapped Children Act was passed to support special education and related service programming for children and youth with disabilities in public schools. This act mandated that everyone with an intellectual disability was granted equal access to a free education. It was renamed the Individuals with Disabilities Education Act, IDEA, in 1990. In 2010, President Barack Obama signed Rosa's Law, which eliminated the term mental retardation and replaced it with intellectual disability. Deleting this term from legislation helped to change the negative stigma associated with disabilities.